Welcome to the lecture that addresses cervical cancer. Of all cancers in women's health, great strides have been made in reducing the incidence of this cancer through screening and immunization. The picture on this slide demonstrates the cellular changes that occur transitioning from normal through advanced cancer. Hyperplasia and mild dysplasia may resolve itself over time by the body's immune system. Carcinoma in situ and invasive changes need aggressive management. There are close to 13,000 new cases of cervical cancer diagnosed annually, and it is most common in Hispanics and African American women. Some of these women fail to come in for well women care. 1/3 of women with cervical cancer will die from it due to its advanced stage at the time of diagnosis. If treated aggressively, the 5 and 10-year survival rates are good. The mortality rate has decreased by 50% due to women having pap smear screening and vaccination. Although this is a very busy slide, it is an excellent depiction of the cellular changes that take place in the development of cervical cancer. You may want to put the lecture video on pause so you can take a good look at the slide. The cells of the cervix have very small nuclei and more cytoplasm because they're mature, while the cells at the basal layer, these are cells that divide most rapidly due to being immature cells, have large nuclei and little cytoplasm. Dysplasia. Low-grade lesions affect the transformation zone. As the cellular changes progress from left to right on this slide, you can see how the immature basal layer replaces the superficial cells. Another thing to note on this slide is how a pap smear is highly specific in detecting the presence of cellular changes, but it is not sensitive in terms of detecting the cause or where the abnormality is located on the cervix. The HPV test is a highly sensitive test that detects the presence of the virus, but it also has low sensitivity in detecting the presence of cellular changes that lead to dysplasia. Therefore, we have a test called the thin prep pap smear that couples the pap smear with HPV testing. Cellular changes in the cervix are detected through pap smears. Cells are scraped from the cervix at the transformation zone, and this is the area where the squamous and columnar epithelium meet. The pap is done when the patient is not menstruating. If the results come back positive, the patient is triaged either for repeat pap smears in 3 to 6 months or directly to colposcopy. Colposcopy is a procedure where the provider is able to look at the cervix through a microscope, which stays on the outside of the body, to detect where the area of cellular change is, then takes a biopsy. This slide shows you what the cervix looks like from normal, which is the bottom left, and then go up and around to the right side. So from normal to abnormal when looking through a colposcope. The MD or NP applies acetic acid, which is white vinegar. It causes the tissue to turn white in the presence of cellular changes. This change helps us to know where to take the biopsies. When you look at the slides on the right and you see the little punctated areas on the top right as well as on the bottom right at the upper edges, this isn't normal, so we would do a punch biopsy. As already discussed, The incidence of cervical cancer is decreasing due to the efforts of healthcare providers in promoting pap smears and vaccinations against HPV, the human papilloma virus. Risk factors for developing cervical cancer, or actually cellular changes and eventual cancer, include the age at first intercourse, the number of sexual partners, the number of sexually transmitted diseases, smoking, and, of course, not having pap smears. How can we detect cervical changes if the patient never presents to us to get the test? The first three are logical. The earlier a woman is when having intercourse, the more likely she is to have a greater number of sexual partners in her lifetime. Remember, teens practice risky behaviors, including intercourse without condoms. This behavior increases the risk of acquiring an STD, the worst of which is HPV. So once again, keep in mind, if a woman doesn't come in for a PAP, there's no way for us to know cellular changes are occurring, increasing the likelihood of presenting to us with advanced disease. This patient calls or comes in complaining of irregular vaginal bleeding and/or bleeding after intercourse. If the pap smear returns with abnormal results, the MD or NP needs to decide on further evaluation and management. The medical management depends on the degree of dysplasia, and it ranges from in-office LEEP, LEEP procedure, which is a laser vaporization of abnormal tissue, an outpatient OR procedure called a cold knife conization, or the most aggressive that involves a TAH, simple to radical. What is the link between cancer and HPV? 25% of people are carrying the human papilloma virus. Types 16 or 18 are implicated in almost all cases of cervical cancer. HPV is responsible for causing not only cervical cancer, but vulvar, vaginal, penile, anal, and throat cancer. The lower risk versions of HPV cause genital warts, also known as condyloma acuminata, and respiratory papillomas. There are many types of HPV, with types 16, 18, 31, 33, 45, 52, and 58 being aggressive and carcinogenic. And of all these types, types 16 and 18 are the most prevalent. Because of this, 3 immunizations have been on the market to prevent cancer: the Gardasil, Gardasil 9, and Cervical. Gardasil is the original and is effective against types 6, 11, 16, and 18. You do need to know this. It is approved for girls and boys aged 9 through 26. The difference between Gardasil and Gardasil 9 is 9 expands the original coverage to include 31, 33, 45, 52, and 58. Therefore, 9 forms of HPV are addressed. The indication for girls is the same as Gardasil, but is also approved for boys only between the ages of 9 and 15. The Cervical vaccine prevents type 16 and 18 and is approved for females only. Because of its limited coverage and use for females only, it was rarely administered in the U.S. Due to this limited demand, the company pulled it off the U.S. market earlier this month. It continues to be available in other countries. The dosage for all the HPV vaccines is 0.5 mL and is given IM. When caring for patients being worked up for cervical cancer, the nursing role includes assisting with procedures, providing education, and administering preventive vaccines per the schedule. If a patient needs a repeat pap smear, the nurse needs to make sure the patient is scheduled. And if she doesn't show up, you need to call and reschedule the appointment. If the patient still doesn't show up or respond to phone calls, you need to send a certified letter to the patient and keep all of this communication recorded in the patient's record. If the patient needs a LEEP procedure, instruct the patient to take 2 ibuprofens an hour before the procedure to reduce cramping. If you are assisting the provider with the procedure, make sure you wear a gown, gloves, and a mask so you don't become infected with the virus as it is vaporized into the air during the procedure. A cold knife conization is performed in the OR under general anesthesia. It involves freezing the cervix, then resecting the frozen wedge of tissue. Both procedures will end with a surgical specimen being sent to pathology for evaluation. As the patient is being discharged after a LEEF or cold knife conization, the post-op care includes pelvic rest for at least 3 to 4 weeks, which includes no tampons. This allows the cervix to heal. The patient should expect a watery discharge as the tissue sloughs. She is to call if she becomes febrile or develops significant pelvic pain, which is beyond cramping. Neither of these are expected. The nurse needs to administer the Gardasil vaccine on schedule. Teach the patient and parent about this vaccine. And remember, the parent will be the barrier to administering this vaccine to their child. Keep current with Pap smear guidelines and promote Pap smears and immunizations at every opportunity. This ends the presentation on cervical cancer.